So, what do you do if your child has been acting out every single day for 7 years? You can ask Debbie. She's here with her mother, Lorraine. Debbie came up with a solution that she said has saved her child, but has caused quite a bit of controversy along the way. Let's start with your son, okay? His name is Jeffrey. At 9 months old, he was out of control. What does a 9-month-old do?
Well, at 9 months old, he had explosive behavior, explosive temper tantrums.
That were not normal temper tantrums.
Not normal temper tantrums.
At 2 years old, he was abusing other kids.
Correct. Correct.
At 3, somebody finally diagnosed him with OCD and ADHD, and they put him on Ritalin at 3 years of age.
At 3 years of age was his very first.
What was he doing that they gave him Ritalin?
He was very abusive to other kids at child care. He had been kicked out of over 8 different child care placements.
At 4, he threw a desk at a teacher and beat up another child?
Right.
At 5, he thought he had robots living in his head and his stomach telling him to kill you.
Right. I've woken up with Jeffrey at one point with a knife to my back.
Did you ever put him in a psychiatric hospital?
Yes, he's been hospitalized 3 times. He's been in residential care. He's been in schools for behaviorally, mentally disturbed children.
You've gone through all that.
Right. On Mother's Day in 1999, Jeffrey became out of control, and we had to do takedowns.
What's a takedown?
A takedown is where you actually have to restrain Jeffrey, get him on the ground, his hands down, his feet down.
In a public store?
In a public store. It was very common. And he had taken a chunk out of my hand, he bit it, and the whole store was silent. They knew us, they knew Jeffrey's behavior.
Thank God they did.
Yeah.
Lorraine, what was this like?
It was a nightmare. We've been very involved because Debbie is a single mom. Jeffrey's dad is dead. And she's needed a lot of help with Jeffrey and supporting her.
Okay. Now, with all of this, he had psychiatric evaluations, he had medications, you've tried absolutely everything. So what was or is the answer, if anything?
Well, the answer, we don't have an answer, but what has helped him live life from May 21st to this day. He's on medical marijuana, and it's changed his whole life.
Explain how you give a child. Is it legal in your state?
It is legal in California.
Okay. How do you give a child marijuana? He doesn't smoke it, does he?
Absolutely not.
He must eat it or ingest it.
He ingests it. It first came to him in the form of muffin.
Muffins.
In a muffin. It was recommended by a pediatrician. And
Lorraine, what did you think when Debbie first said, let's give the kid marijuana?
I thought she was crazy.
Okay, but she tried everything. What has his life been like since he started on marijuana?
Wonderful. He has not had an outburst. He hasn't been aggressive. He's able to live life.
Okay. Do you think he'll stay on marijuana his whole life?
You know, we don't know. What we know is what we're doing today.
What you know is this works.
This works
when nothing
today.
else worked.
Absolutely.
The use of marijuana as medicine is a very controversial topic, both ethically and medically. So we've asked 2 experts with 2 completely different points of view to come here. Please welcome Dr. Ginny Klein and Dr. Dan Shapiro. Both are PhDs and both have studied up on this topic. Okay. Dr. Klein, start with you. What do you think of Debbie's solution for her son Jeffrey?
Well, first of all, I have a lot of compassion for what you've been through.
My goodness, what she's been through.
And respect for all of your searches for a cause and cure of this behavior. Unfortunately, the pills in the pot solution quiets the behavior but never gets to the cause of the behavior.
Let me just understand. Should she be using marijuana, which is saving her life,
Yeah,
maybe
saving
more ways
her
of-
life, yeah,
Should
I
she
can
be
understand.
using this, or should she not, or should the child just be in therapy?
Well, I think what happens is focus in therapy has to be correct. I don't think that the use of marijuana
You think she
is
hasn't
going
found
to-
the right therapy?
Well, it's quieted his behavior, but I don't think she's found the right therapy at all. We do not understand that children will build inside themselves some powerful creature that hates them for not being able to live up to it.
He's
So
how
his
old now?
anger
He's 8.
is externalized to the outside world.
But if a
Replace
child
what
is doing
there.
all the things this child did,
He needs a
isn't that-
different kind of therapy, and you did not find it.
Right.
And
Okay, on
the
the other...
understanding is important, but I appreciate what you've been through.
On the other side, Dr. Shapiro, as I understand it, Dr. Shapiro, you had cancer, is that correct?
I did.
And you used Mom's Marijuana, the title of a book you wrote, right?
That's right.
What was the reason for you taking marijuana?
In 1987, I was diagnosed with cancer and had intractable nausea and vomiting as a result of chemotherapy.
Ah, yes.
And was told by another patient, and my mother was a lot like Debbie. She was completely against drugs, very conservative person. But when we realized that the conventional medicines failed and there was nothing else available, we tried it, and it worked. And then when my mother saw how expensive it was, she grew a large crop in the backyard.
And you've written a very delightful book, may I say, called Mom's Marijuana. Now, what's your view on Debbie's decision to give her child marijuana?
With all due respect to Dr. Klein, I think she's missing something that happened very similar to what happened to me when I was using medicinal marijuana. And that is that sometimes conventional medicines, conventional neighborhoods, and conventional schools fail our children. And that we need to do exactly what Debbie has done, and that is to persist and keep going and keep trying things.
I think we have to look for, I agree with you, we have to keep trying, and I think we have to look for the root. Because if you cut down a cactus and the root's still in the ground, it's going to grow another cactus.
Well, you mean
But
because...
that fails to acknowledge all the treatments, all the behavioral treatments she has already tried with some very competent people. He was born, Jeffrey was born different than other children, and conventional medicine hasn't
solved
for
his
him,
problem,
hasn't solved
and
it.
marijuana has.
It hasn't solved
How
his
many...
problem.
All right, but it's helped
It has
solve his
helped
life.
him able to even participate now in therapy. He is able to manage himself enough to get the therapy.
How many states is marijuana legal for medicinal purposes?
I believe-
9.
9 states. Okay, lie detector results are in. Is there hope for peace between two moms who had a murder come between them? All of those questions. We'll be right back.
And now from our reaction room,
We have Jeffrey on medical marijuana, and it's allowing him a life that he hasn't had before. You do whatever it takes as a mom for your child.
I guess in a way we do have our grandson back. He's got a sense of humor. He's a neat little kid.
next.